Well, good afternoon, everyone. I'm very grateful for the opportunity to be able to speak to you this afternoon. Of course, even more so given the pandemic situation. But like others, I'm heartbroken we can't all be together in Vienna. So hopefully we'll be able to meet in person soon with a bit of luck. So what I thought I'd do was I'd start off with just some reflections from the day very briefly on this. And I wanted to preface the talk by saying that I don't think we should give GDPR too much of a hard time. I think it's been a landmark piece of legislation that put into practice a lot of basic things that information governance experts like myself have been saying for years, but hadn't got any real basis to enforce or to engage. One thing's for sure is that GDPR has made us all think very carefully about how we handle data, but it's made it a topical discussion that has hit the mainstream on an epic scale, not just within Europe, but all around the world. I've been involved with work at the European Institute at UCL on looking at the impacts of GDPR, the implications of Brexit, and the implications around Privacy Shield. And one thing's for certain is that the international perspective that we've gained demonstrates that there is a great deal of attention on this, whereas before this was more of a kind of nuanced point that legal and information governance professionals would engage with computer scientists over at a smaller scale. And before I proceed, just to say, I wear several hats. I work with UCL, of course, and the Institute of Health Informatics. I'm also the information governance lead for UCLH, NHS Foundation Trust on research and innovation. So I will be peppering my talk with some anecdotes from the real world in terms of those areas. But today I'm here as the information governance lead for IHD, the European Institute for Innovation Through Healthcare Data, and I work very closely with Deepak, whom we heard earlier. So whilst I don't think we should be too hard on GDPR, I do think we should be quite hard on what I would call abject stupidity. Unfortunately, we've had a few examples across the UK of how not to do things, which I'm hoping everyone can learn a few lessons from. But I felt this case was particularly pertinent for our talk today, especially within the context of what we're discussing, which I'll come to shortly. Our Prime Minister referred to the recent fiasco about managing A-level grading as being the fault of mutant algorithms. But what we saw here was the deployment of mass profiling across our A-level and our GCSE students to be able to account for the fact that we just couldn't have them sit exams. Now, where they'd already sat exams and done mocks, their teachers have graded them and they've made recommendations and provided a recommended grade. But our quality inspector for education decided that in case of a bias kind of towards a more positive view on the results from the teachers, they deploy this algorithm. Unfortunately, the algorithm would actually result in a lot of grades being dropped to the point that many thousands or tens of thousands of students weren't going to get their first choice at university, would have to rethink their futures and so forth. But then it emerged that the algorithm was using all kinds of metrics and biases, particularly around where the students were going to school, where they lived, and very often their individual circumstances where these were known. And in many ways, it's applied a very, shall we say, Victorian prejudice that was rife in England about 200 years ago about judging people on where they went to school and where they were from. So in many ways, what was achieved with this algorithm was to computerize that prejudice. And as you can see from the photos, which came from the Financial Times, The Guardian, two things are clear here. First of all, I think we have a bright future because our young clearly nail complex issues. They actually highlighted all the issues with misapplied artificial intelligence in their placards. And so I think they seem to be able to understand these issues very well, probably better than me. And second of all, as a brief aside, most of them are actually wearing face masks, which is something of an amazement at the moment, given the situation. But ultimately, the decision was reversed, but the damage was done. People had already made different choices about university or whether they're going to university or not. Things had already been set in stone. This is a very complex area. And when we think about these kinds of applications in the healthcare space, especially in the NDD and Alzheimer's and dementia space, we have to be very, very careful as to what we're actually dealing with. So I want us to think about context and wider context when we talk about these algorithms and take lessons from where things have gone wrong. So entirely about context, we've looked at regulation in great detail today. It's been a very rich discussion about what's available, what's in play, and where the challenges lie. But I've always viewed regulation as the foundation on how you proceed. Laws are passed, regulations are passed, good practice guidelines are passed, and professional standards are developed, standards are developed. And certainly in the UK, with a common law tradition, our legal system will look to statute, it'll look to common law, it'll look to professional standards, and it will look to wider international standards for best practice, where answers may not be clear in a particular case. But thinking about this, to my mind, there are two broad areas, both interrelated, where we have to get this right. First of all is in care provision. When it comes down to it, very much of our data comes from the therapeutic relationship under a duty of confidence between patients and their practitioners. As we know, within the neurological area, we have particular challenges there, particularly around capacity to consent, which I'll come into shortly. So the doctor and the patient and their care team have to be within this trusting relationship to get anything done, especially around making sure that information is shared. But we also have a vibrant community doing research that involves not only the healthcare service and the patients, but also industry in terms of pharma, but also in terms of tech companies looking to enhance care. But we have to make sure that it's not only safe, but also effective in terms of what we're doing. And when you start to think about algorithms and machine learning in this space, we start to have a very different lens as to what we're trying to regulate. So moving forward, for neurological degenerative disorders and dementia in particular, these are fraught with complexities. Certainly across Europe, the concerns around capacity to consent are clear. So whether it's individuals who are the patient or their families or carers or proxies who are involved, the actual ability to consent to research, for data use, for any of these kinds of areas is already within a complex area. And when it boils down to it, we don't know very much about these conditions and their progress. We know some, but we've all recognized that we don't know enough and we need to find out more. But ultimately, the management will very much be about the observation and measurement of physiological factors, where interaction with individuals will be less revealing, particularly if individuals sadly don't have anyone else who is actually their proxy or is caring for them. But when it comes down to it, in terms of thinking about the transparency discussions we were having earlier, how do we get this right, particularly in this area? How do we gauge feeling about this? And what can we actually do with this to make sure we're actually being much more detailed about how data is used? And when it boils down to it, how can we be meaningfully transparent? These are some of the challenges that we're posing. I'm hoping I can go some way to providing a basis to answer moving forward. But the other elements that apply to all applications of health are around how can we assure that data is not biased and lead to flawed decisions and diagnostics, and how do we know the damn thing works when it comes down to it? These are all very difficult to consider. So I won't spend too long on this slide. I'll just cherry pick a few points, because like I said, we've already had a rich discussion about the regulations. But to my mind, GDPR, I've never seen as a single tool. It's part of, it's one tool in a very large and complex toolbox. I prefer the analogy of a tapestry in terms of regulatory compliance. A tapestry of different laws, different case histories, different precedents, and different standards and considerations, where GDPR is most certainly not the only game in town, but it has emphasized the importance of protecting data, whether you're within Europe or beyond in terms of other countries and jurisdictions. But when it comes down to the automated processing, I think it's fair to say that the primary concerns when the European Commission drafted did the first draft of GDPR were around the savings and loan sector, where increasingly data was being used to determine whether you got a mortgage or not. Nowadays, we're talking about whether a machine decides to dose someone with a different amount of oxygen when they're recovering from operations, or indeed offering diagnoses to people. So this notion of the closed loop decision making, where people have a right to ask a human to make that decision in broad terms, suddenly takes on a new perspective. When it comes down to it, if you were to deploy an algorithm, let's assume that it's passed all its EMA and CE marking requirements and so forth, the decision's already been made. The patient can't very well go back and say, actually, if you reverse that decision and can a human decide? So we need to bear that in mind. We have to make sure that there's a process by which we offer people the choice, or we're clear about where the algorithms need to work within the relationship and the intervention. So I think those kinds of smaller points or very focused points, I haven't heard of any encounters of that regard yet, but we can foresee that there are issues that are moving forward for that. So with GDPR 2, if there is a 2 or a GDPR 2.0, whatever you want to call it, we might want to address these in a little bit more detail with deference to rights and clinical practice. But as for other regulations and so forth, of course, we know about the CE marking and EMA and so forth. But also the big push there was, especially with the focus, if not obsession, with ethics in broad terms that we heard about earlier, in terms of looking at whether the use of AI was ethical and the kinds of concerns that raised. And that's where we saw various tech companies putting in ethics committees and ethics oversight boards and so forth. And between the various items of work on this, be it American, be it Chinese, be it European, be it Middle Eastern, broadly speaking, when I did a brief review of this last year, I counted about 75 different principles that had no real practice in terms of implementation. And then I thought, being generous, there are probably about 30 distinct different ones when it comes down to it. But if I'm being unkind, there are probably about 5 when it boils down to it. But what's useful about this exercise is how we might put it into practice. But then, of course, we have the regulations around traditional medical and scientific research that we've also talked about, between duties of confidence and research governance requiring ethics. But in a lot of cases, when you're looking to deploy a new algorithm, will an ethical review have been conducted? If you're able to justify the use of the tool within a particular context, it may be the case it's exempt from ethical review. This is certainly the case in England, and more widely across the other UK jurisdictions, and more widely across Europe, where in America in particular, there have been concerns around being able to find people who are competent and available to be able to do any kind of ethical review with any kind of heuristic. So we do have issues there, absolutely. But we know that there are challenges for AI already, partly through this ethical consideration that's been ongoing for a few years, but partly through putting things into practice. So we know that the data may be not representative of everyone. It may favor a particular group. And is it representative in the context of use? So if you've done your machine learning algorithm training on a predominantly white male population, how can this apply to a Middle Eastern female population? It obviously can't. There are issues there. Is it accurate? So is the machine learning that's been performed accurate to begin with, but also decision-making, is that fair and reasonable? And how do we judge that? And where's the equity here for everyone concerned? It's patients' health after all. It's their medical professionals' logging of data and considerations there. So if we are going to feed this data into these machine learning algorithms, what are they getting back individually? There is still a balance there to be struck. And it's great to be altruistic and say this is for the good of society and so forth. But at the same time, if you hadn't been asked permission and you found that this had been used to save other people, how would you really and honestly feel about it? Certainly where you're either caring for someone with Alzheimer's dementia or have it yourself. Is it safe? So are we going to be able to make clinical decisions upon this? And can you explain what on earth is going on under the bonnet, so to speak? So the black box nature of these algorithms mean that it's very difficult to explain in certain circumstances and certain cases, but should we even try? So there's something to table just for a moment. And how can we be transparent here? And is this for societal good, or is this purely for profiteering? So these are all important challenges for AI. How do we start to look at these issues? So by no means is this a shameless plug. I was interviewed on ITV Tonight back in February, and the show actually aired about a couple of weeks ago. And my feeling was that even though, I'm only in it for about a minute, if that, but the other speakers and interviewees, I think, frame this area really well. When it boils down to it, in healthcare, we have real challenges and critical game-ending challenges. We have real capacity problems in terms of professionals who are able to deal with the workload that is before them. We have cases of human error where clinical error has come into play and disastrous results have happened. There's an absolutely heartbreaking story about this within the report. There are concerns about clinical safety and the efficacy of traditional approaches to medicine and treatments that we have to contend with. But there's also a developing area which I think gives us some hope, where in England in particular, our national data guardian, Dame Fiona Caldicott, has launched a consultation about how we might embed reasonable expectation within law. So what might an individual reasonably expect in terms of data use? This is often something that English courts will go back to, and data controllers will go back to in terms of what might be reasonably expected in terms of data use when other answers aren't so forthcoming. So just to put a frame on this, I think this would be, if you've got a spare 30 minutes, I would see if you can access this and have a look. So I think this framed the entire area really well. And I had no idea what the other interviewees had said. So I think this is important to bear in mind in terms of how the public are actually viewing this kind of area in terms of AI in health. So I've talked an awful lot more generally. I think within the area of virtual brain cloud and in terms of the work that's being done, it's absolutely heartening to see the level of detail that people have worked with in terms of applying GDPR and its principles, as well as being mindful of the context within which the algorithms are being scanned and which are being used for research. And this is a shining example of the way things need to go. It's an awful lot of hard work, but other initiatives like this can learn a lot from us. But here's something I would like to propose in terms of moving forward. When it comes down to it, artificial intelligence cannot replace natural people professionals. So you will always need a doctor, a human doctor, in position to be able to interpret things and ultimately make decisions in partnership with the patients as to what's best. But AI can certainly support them, particularly when they might miss something, particularly when the research being undertaken within the virtual brain cloud can provide new insight that a human simply could not have retrieved by thinking about it. But when it comes down to it, in order to train things up, I've looked at this area by thinking that AI and algorithms are autonomous agents when it comes down to it. We can't very well explain why it reached a decision any more than we could do a scan of a human doctor to determine how they managed to reach a diagnosis. We rely on their training, rely on their experience, and their ability to justify themselves. So if you are going to train algorithms, let's train them, let's educate them, and let's examine them. Let's make them sit an exam. Let's see how they perform in different contexts. Much like a trainee doctor will be put on wards, only we can do this in simulated environments. And much like a human doctor will sit an exam and actually answer questions about this. So why don't we think about that as a possibility to be able to assure the technology and the approaches, particularly if we are having trouble explaining how it works. So, but otherwise, the CE marking process, as it stands, will really struggle to assess these complex heuristics, and you'll spend months, if not years, looking through each process, trying to test things out in that regard. Now, it's not impossible, but should this not be part of the ability to say, well, the whole is more than the sum of its parts. So let's look at it in that basis. Let's make it do an actual test in context without making it too singleton or piecemeal. But on that note, I'm going to end. So why don't we have a school and exams for algorithms? Why don't we have the educational approach? But for heaven's sake, thinking about the UK's recent experience, let humans judge them and mark them. Let them make the final decision. This will guide the transparency and the understanding that we can purvey to data subjects and the public more widely, but it will also assure codes of practice as well, which we've identified as important tools in this space. So on that note, I've got to start my stopwatch, so I hope I'm not too late. I'm going to say thank you, and I shall look forward to questions.
Yeah, thank you very much for your challenging and thought-provoking presentation.